Welcome back to my channel Knowledge Chronicle.
Today, we're going to talk about a topic that is natural, important, and yet often misunderstood: the menstrual cycle. Whether you're a student, a parent, or just someone curious about how the human body works, this video is a must-watch. Let's dive deep into the science of the menstrual cycle, its phases, hormones, hygiene practices, and a lot more, all in under 5 minutes. What is the menstrual cycle? The menstrual cycle is the reproductive cycle in female primates. That includes humans, monkeys, and apes. It begins at puberty and continues until menopause. The very first menstrual flow is called menarche, and the last one, when the cycle stops permanently, is called menopause, which usually occurs around the age of 50. The cycle usually repeats every 28 to 29 days and prepares a woman's body for a potential pregnancy. The events from one menstruation to the next form what we call the menstrual cycle. Phases of the menstrual cycle. There are 4 main phases in this cycle. Let's understand each one in simple detail. First, the menstrual phase, from day 1 to 5. This is when the menstrual flow, or bleeding, happens. It lasts for about 3 to 5 days. But what exactly is this flow? It's the shedding of the inner lining of the uterus, called the endometrium, which breaks down along with blood vessels and comes out through the vagina. This only happens if the released egg or ovum is not fertilized. It's like setting up a room for a guest. If the guest doesn't show up, fertilization doesn't happen, the room is cleared. Next, the follicular phase, from day 1 to 13. Even while menstruation is happening, another process begins: the growth of follicles inside the ovary. One of them becomes a fully mature Graafian follicle. This follicle carries the egg. Meanwhile, the endometrium starts rebuilding itself, getting ready again, just in case fertilization happens this time. This process is driven by hormones. FSH follicle, stimulating hormone, and LH luteinizing hormone, both secreted by the pituitary gland in the brain. These hormones also stimulate the release of estrogen, which helps the uterine lining to regrow. Then, the ovulatory phase, around day 14. This is the midpoint of the cycle. When a dramatic event takes place, the mature follicle bursts open, releasing the egg. This process is called ovulation. It is triggered by a sharp rise in LH, called the LH surge. Think of it like a balloon filled with water. When pressure builds up, it bursts, releasing the water, or in this case, the egg. This is the most fertile period, meaning if sperm meets the egg during this time, fertilization can occur. Luteal phase day, 15 to 28. After ovulation, the burst follicle turns into a structure called the corpus luteum. This corpus luteum now starts producing progesterone, a hormone that thickens the uterine lining even more, making it ideal for implantation of a fertilized egg. If fertilization does happen, the woman becomes pregnant and the menstrual cycle pauses. But if the egg is not fertilized, the corpus luteum degenerates, progesterone levels fall, the endometrium breaks down. And this leads to menstruation again. And the cycle begins anew. The menstrual cycle is a powerful sign that the female reproductive system is working normally. It's a delicate balance controlled by hormones. Disruption in this cycle can signal problems like stress, illness, hormonal imbalance, or even pregnancy. Now, let's talk about something equally important: menstrual hygiene. Good hygiene during menstruation is essential to avoid infections and maintain health. Here are some simple yet crucial tips. Take a bath daily and keep your genital area clean. Use sanitary napkins or clean homemade pads. Change your pad every 4 to 5 hours to avoid infection or skin irritation. Dispose of used napkins properly. Wrap them in paper before throwing in a dustbin. Never flush pads or throw them in open areas. After changing, always wash your hands with soap. Good hygiene not only keeps you healthy but also builds confidence and breaks the stigma around menstruation. So to recap, the menstrual cycle is a monthly cycle in females involving ovulation, hormonal changes, and menstruation. It involves 4 main phases: menstrual, follicular, ovulatory, and luteal. It's regulated by hormones like LH, FSH, estrogen, and progesterone. And maintaining menstrual hygiene is key to a healthy life. Understanding the menstrual cycle helps us appreciate the complexity and beauty of the human body. It's time to normalize talking about it, because it's not taboo, it's biology. If this video helped you understand the menstrual cycle better, please don't forget: your one like, share, and subscribe will help us create more valuable content. See you in the next video, only on Knowledge Chronicle.